Is preparing to have a briefing about the current coronavirus pandemic. We're taking you live for this breaking news.
Dr. Scott Milton, Public Health Authority, Texas Tech University Health Sciences Center, and City Manager Jared Miller. We'll open it up to some statements from our panel, and then we'll take questions directly from our media. At this time, let me go ahead and turn it over to Amarillo Mayor Ginger Nelson.
Good morning, Amarillo. I hope you've noticed that we have new information on our Amarillo Alerts website for you. Of course, we're still doing the daily report card, but you may be interested in seeing that information in a different format. And so we've introduced the dashboard this week. You have to go under the report card, and there's a dashboard link there that you can click on, and it'll bring up different graphs. Much of it's the same information, but it's presented in a different way so that you can look at it and consider what the data is doing in a graph format. So I want to make sure that citizens are aware of that. If you haven't looked at it, take time and look at the dashboard. And I want to thank our IT department for putting that together. That's obviously a brand new tool, and a lot of hours and a lot of time went into making that available for us. So I'm really grateful to our IT team. Somebody else that I want to thank today is our Asl Interpreter. Every press conference and every meeting that we have had related to COVID since we started this situation, we've had an Asl interpreter with us. And so I'm really grateful that our community is able to include those who need this type of interpretation. And I'm thankful that we have people in our community who are willing to serve in this role. And then I also want to thank our communications team, because they're doing such an excellent job of pushing out information to citizens and giving us the opportunity, a platform like a press conference 3 times a week and other different interaction opportunities with the citizens. They're working so hard, and so I wanted to say a special thank you to our communications team. And then this morning, I just wanted to go into the weekend thanking our media partners. They've come every time we've had a press conference. They're here 3 times a week and other times, and you guys have been doing extra duty to help us keep the public informed too. And so I really, really appreciate your professionalism and your dedication to helping us push out good information to our citizens. That's all I have this morning, Dave.
Thank you, Mayor. This time, let's go to Casey Stoughton, Public Health Director, City of Amarillo.
Good morning. As of yesterday, there were a total of 1,993 cases of COVID-19 reported in Potter and Randall counties. 1,462 cases in Potter County, 477 cases in Randall County. We've had a total of 397 recoveries. There are a total of 27 deaths reported in Potter and Randall counties. That leaves us with 1,515 cases, active cases. The numbers reflected on the 230 report card will reflect additional information. We have started to receive additional test results from Tyson, the testing that was conducted out there from the Texas Military Department, and we appreciate that work. Earlier in the week, I reported specific numbers of positives and negative, which were different than what was reported on the report card. We receive results from the state often late in the day, and there's quite a bit of work to tabulate them for reporting. When we received the second batch of results, we realized that there were some duplicate numbers on that report, which made the reported numbers that were reported on the press conference different than what were reported on the report card. And so we want to make sure that moving forward, we have enough time for our staff to tabulate those numbers so that they're very accurate, but we also have to have time to take out those duplicate numbers. Last night around 9:30, we received a third batch of results, and our team is working hard right now to ready those numbers for report. I hope to have more information on the 230 report card today. Tuesday, we received word from the governor that who has directed all nursing home staff and residents to be tested for COVID-19. Amarillo Public Health is collaborating with area nursing homes and our Amarillo Fire Department to accomplish this goal. It should be completed next week. Drive-through testing continues today, provided by Amarillo Public Health and Texas Tech Health Science Center. That testing continues today until 3 o'clock. If you'd like to be tested and if you're symptomatic and would like to be tested, Please call 378-6300 and our call takers will screen and direct you to testing. Thank you, Dave.
Thank you, Casey. This time we want to go to Dr. Scott Milton.
Yes, I wanted to remind everyone to remember to practice social distancing, to remember to wear a mask while you're out in public, and to avoid congregating, as I do every time on this event. Our hospitals are faring well. Our capacity is good, and in fact, I think it's safe to say that the burden of COVID on our hospitals has diminished over the last week. So we're all happy to see that. In terms of convalescent plasma, that is still ongoing. The numbers haven't increased that much this week, as we seem to have fewer candidates, which is a wonderful thing as well. We're still about 30 to 32, and it seems that our supply is good. And then finally, I'd mentioned remdesivir. We did receive that shipment earlier in the week, and we have administered that to one patient already, and we are working out the details to make sure that it's going to be available to everyone in the community and at both hospitals. I will say that it's a very small supply, and it's a precious commodity, so we're going to use it judiciously, and that's all I have.
Thank you, Dr. Milton. This time I'll go to City Manager Jared Miller.
All right, calls for service for public safety are very close to annual averages for the last year. That indicates that people are out and about more, and the main thing I want to encourage people to do as they're doing that is to take care of the people that they're going to be interacting with, take care of the people they're around when you're out and about, as Dr. Milton recommended and Casey Stoughton recommended. Please wear your mask, do the things that are going to take care of the people that you're shopping with and interacting with and buying from. Amarillo Alerts, as a reminder, we recently announced a new emergency notification system to provide current and factual information on a variety of events, including COVID-19. I want to encourage citizens to continue to sign up for the service at AmarilloAlerts.com so you can stay informed. As of this morning, we have 6,190 people signed up for these alerts. We did our first test of the Amarillo Alert system yesterday. I think if you've already signed up, you notice that worked really well on email, text, and any other communication tool that you registered. As Casey said, last week at our mobile testing site, at our drive-through testing site, we had our biggest week of testing so far, testing 718 people. This week, we've tested 483 people so far as of close of business yesterday. If you feel sick, if you feel you have symptoms consistent with COVID-19, please call Public Health Hotline at 378-6300 to be screened for the drive-through testing center. Also want to remind everyone that yesterday was our final day for the drive-through pet pantry. With help from Merit Pet Care, who provided all of our food, we were able to provide assistance to over 4,200 people with this program. Going forward, Animal Management Welfare will continue to support the needs of our community's animals during their hours of operations at the Animal Management and Welfare Center. For questions on current shelter operations, please call 378-9032. Now I just want to go over a couple of final reminders on the Governor's Executive Order GA-21. It expanded the reopened services that began on May 1st. Those reopened services included in-store retail services, dine-in restaurant services, movie theaters, shopping malls, museums, and libraries. Reopened services expanded again on May 8th to include cosmetology salons, hair salons, barbershops, nail salons, tanning salons, and swimming pools. They're going to expand again on May 18th to include office buildings, manufacturing services, and gyms and exercise facilities. All of the things I just talked about under GA-21 are required to operate at no more capacity than 25% of their allowed occupancy. The Environmental Health Department and the Fire Marshal's Office are continuing to monitor compliance and to assist businesses to be compliant with the Governor's Executive Order. We do expect the Governor to, on Monday, this coming Monday on the 18th, to provide further guidance on whatever follow-on orders to GA-21 will happen, and we will communicate that with everyone when that happens. One final thing is that people shall continue to avoid visiting bars, massage establishments, tattoo businesses, piercing studios, sexually oriented businesses, or interactive amusement venues such as bowling alleys, video arcades, amusement parks, water parks, or splash pads. All of that is subject to change in the next Governor's order, but we don't have any indication on when or how that's going to take place. That's all I have, Dave.
Thank you, Jared. At this time, we want to open up to questions from our media. If you have a question for an individual panel member or the panel as a whole, that's perfectly fine. Let's go ahead and start with Ramon Godoy, publisher of the El Mensañero newspaper. Ramon, how are you?
I'm doing fine. Thank you, David.
And of course, we'll keep you updated throughout the day. And you can also follow all of our updates at myhighplains.com. We'll send it back to regularly scheduled programming.
Who is in charge? Because it doesn't make any sense to duplicate since it's just one entity performing those tests.
So, Mr. Godoy, the names were reported 2 times, and so we're just working to make sure that we only report it out 1 time, and so our staff is working on that to make sure that the information that we have is reported out to our community, where everybody is only reported out 1 time.
Okay, still so confused to me. Let me ask you another question. What happened with sick people? What happened? I know personally some families around town who are, let's say, dad is sick and then he comes home, mom is sick, and now 3 or 4 kids are sick. They are not allowed to go and buy groceries. Who is taking care? I mean, I know personally community is helping. You know, people buy stuff and drop at the front door and so on and so forth. Is food bank, City of Amarillo, food pantry, is somebody, because as far as I know, nobody's helping those families.
So our team calls each of the patients every day, and when they indicate to us that there's a need, then our staff helps to fill those needs. And we have lots of partners, and so we are thrilled to be working with Snack Pack for Kids, St. Stephen United Methodist Church, Oasis Baptist Church, Potter County, have all stepped in to help fill the gap. And so our team communicates those needs, and then we work with those other entities to help us fill the gap and make sure that those families have what they need.
Do you mind to share that information by email or some way? Because, I mean, people call me and ask me for help. And I said, I don't know, I think somebody's is working with. Now, my next question is for Dr. Milton about remdesivir. Is this a part of protocol? Is somebody doing a study about it? Since Amarillo received 2 cases and Lubbock 1, and Dallas received 4, and Austin received 3 of them. Is anybody doing a study, or is part of this as a protocol, or is something else behind that?
So there's been a fairly large study for remdesivir that was performed, I think, over the last couple of months, I think with more than 1,000 patients. And so that study determined that there was I would describe that as a marginal benefit in individuals who are critically ill and receive the drug. So the way I understand that, when that study was published, then the company, which is Gilead Pharmaceuticals, just released the drug to be given for free. And so it was dispensed to the state, and then the state allocated the drugs to the various hospitals in the state. And so it's not actually part of a study that we're participating in. We're glad to receive some for use in this community. Does that help?
Well, to me, it's really concerning. Lubbock received 1 case and Amarillo 2 cases, but I mean, I think this is something else behind. But now, let me tell you, remdesivir was used on SARS and MARS before. It doesn't prove a real clinical deal. And that's why I'm thinking this is part of protocol or something, since the company give those away and to the state of Texas. The state of Texas send it to different communities. Doesn't call your attention that?
Do you want me to comment on? I'm not sure what you want me to comment on. Is that? Do you think that remdesivir is I just don't understand, because I just explained that there was a study that was done that showed there was a marginal benefit and that it was safe to give.
Yeah, I think at this point, anything could help, since chloroquine, remdesivir, azithromycin, or any medicine, needs to be proved. Now, my concern is if this is part of a protocol or something else. But I think you have not the answer, because nobody has it at this point.
Yeah, I think that, I think everybody's being above board. That's my opinion. And I think everybody's trying to do the right thing. And certainly we are monitoring the patient closely that's receiving this drug to make sure that there's no harm done. But there's some science that suggests that it is marginally helpful.
Yeah, I understand. Yeah,
time for one more question, Ramon, please.
Yes,
one more question.
Just one more question. I remember SARS and MARS was used. Now, the last question is for your crystal ball. Do you have now pick for this situation? Because this is not an outbreak. This is a pandemic, and at this point, I'm sure you guys have to have numbers and projections, since numbers are increasing every single day.
Yeah, so I think that the reason, and I've said this before, the biggest concern, Ramon, is making sure that our hospital capacity is not overrun. And I feel a lot better about that today as compared to 2 or 3 weeks ago. We just didn't know where we were going to go 2 or 3 weeks ago, but we seem to have gotten over the hump. In terms of cases, the more testing that becomes available, the more cases we're going to find. And so I think those numbers will probably continue to rise to some degree. But also, as people recover, then the number of cases that are recovered that it's reported on our website will also increase. And so we're looking at kind of the net total. So I kind of see that in a more complicated manner, and we start talking about a peak. Another way of looking at that is that, the strategy here is that we want to try to keep people as healthy as possible and keep the hospitals running, and then buy us time for a vaccine. And hopefully that would come, within the next year or so. And if that's available, then we can, then I think we've won the war. But until that point in time, I still think that we'll probably see cases, and we're going to have to be diligent about our social distancing and masking, and we're going to have to be very cognizant about the vulnerable populations. Right now we're concerned about nursing homes, and the governor has demanded that all nursing home residents in the state of Texas be tested, which I think is a great thing. And because they're a very, very vulnerable population, and we need to know what the burden is in our nursing homes locally, so we can help mitigate any potential outbreak and illness.
Thank you, Ramon. Let's move on now to Jack Kessler, KMR Channel 4. Jack, how are you?
Good, you?
Good, thank you.
This first question is for Mayor Nelson. I know phase 2 of the governor's reopening Texas starts on Monday. Are we ready for that phase and to reopen gyms and office spaces?
Well, I'm really grateful for the response that we've had through the phase 1 reopening. Our business owners have been so responsible. It falls back to you, Jack, and to me, just as individuals. What are we willing to do with good hand washing, with wearing a mask when we go out, and maintaining our distance? It's still hard culturally. We still want to be in groups, and we want to be shaking hands and giving that hug to our friends. But if we will choose to distance ourselves, then I trust what's happening with the governor's leadership, because it falls back on us as individuals. And I value that as an Amarilloan, the chance to make my own decisions and the chance to take responsibility for myself and responsibility for my neighbors. So when I wear a mask, I might be protecting myself a little bit, but what I'm mostly doing is protecting my neighbor And as we've seen these test results come back, even with the folks we're testing who are asymptomatic but yet positive, we recognize that you can be sick and not even know that you're sick. So wearing a mask is so important for taking care of those around us. And I think as we move into phase 2, which the governor has been 100% in how we're doing the phasing, it comes back to us as individuals. And I think wearing a mask is a very important part of that, just social distancing and the hand washing. So I know y'all get tired of hearing us say that, but that's the message.
Thank you, Mayor. This next question is for Dr. Milton. Are antibody tests available locally?
Yes, there are some antibodies testing available locally. Now, at the health department, we don't perform those tests. We perform a nasal swab for a PCR where you're checking for viral particles. And I think, that's important because that test implies that you're contagious. And we want to, and that's what our main goal here is to reduce the burden of contagiousness to our community. Antibody tests, as you know, are a test that are more indicative of a previous exposure and the development of an immune response that may be protective. And so we don't perform that at our health department, but that is available through commercial labs and private labs in Amarillo.
And what can those antibody tests tell us?
Well, I think, as I said, antibody tests offer what you're detecting are proteins that are produced by the body in response to a previous infection. And so what that implies is that you have developed an immune response to that. Now, trying to interpret whether that's a protective immune response or not, it gets a little bit more complicated. But I think it's fair to say that this virus is similar to other viruses and that you will develop some level of immunity to that after you're exposed to it.
Thank you, Dr. Milton. This next question is for Casey. What is the average age for the people in our area that have died for COVID-19?
So most of our cases are over the age of 50. And that information you can see on the dashboard. And so we're really proud of our new dashboard. But you'll be able to see that the majority of our cases who have passed away are over the age of 50.
And what assisted living center in Canyon is the hotspot, if you could tell us?
So I think that, with the governor's order that each of the nursing facilities that have to be tested, we will see, just like we have seen in any number of situations where there is lots and lots of testing being done, we will see larger numbers of testing or larger numbers of positives. And so I think, again, more importantly than just which one it is, I think the major thing to take away is that this is a vulnerable population, and that we need to wearing our masks, making sure that we're protecting that workforce that works in those nursing homes and assisted living centers is so important, because they have such a hard job in that they're caring for our loved ones. Many of our grandparents live in these types of facilities, and so they're caring for our vulnerable populations. And so I think it's important that they have our support, and that we're able to test them and that we're able to care for them.
Is there any word yet on when the governor's disinfecting team will be hitting the area assisting living homes, Casey? Yes, so that will start taking place pretty quickly. So they will actually be testing, and not necessarily, they'll be disinfecting after they test, but not necessarily just a disinfecting team. So it will be a testing team, and then so each of the nursing homes are required to test, and then there's a disinfection component that comes after the testing, but that they'll be testing, and that will occur. That's already started occurring. I have no further questions. Thank you, guys.
Thank you, Jack. Let's go on to David Gay of the Amarillo Globe News. David, how are you?
Good. Happy Friday, everybody. Just a few questions. I guess with that update regarding, oh, this is for Casey, my apologies. With the update regarding the Tyson numbers and with them coming so late and taking the time to make that separation of those numbers, will those numbers from the Tyson plant be separated in some way, shape, or form on the report card so the public knows, I guess, which tests and which positives are coming from Tyson and which aren't?
So not on the report card, but it's our goal to be able to communicate that on the press conferences, but not specifically on the report card.
Okay, so with these new numbers, you'll discuss on, I guess, on Monday's conference, kind of the separation regarding this third batch of numbers that came through last night.
Yes, and we hope. I mean, so our hope is that we'll have total tests soon, and that we can talk about those. That information. So, as the information kind of comes to us, our hope is that we'll be able to talk through that in its totality soon. But we'll be able to have that information cleaned up, and we'll be able to speak to that on Monday.
Absolutely. And while I have you, Casey, is there any updates regarding the CDC's report on the meatpacking plants and those suggestions that the CDC is making to the area meatpacking plants?
Absolutely. So we should have that back from all of the approval processes maybe later today or Monday. And
where will that be published? Will it be published on AmarilloAlerts.com? Will it be published through the CDC's website, just so the public can have access to that report?
So that's a great question. I don't know exactly, but it will be distributed to the beef packing plants individually. So they will each have an individual report, and then we can work with our media partners to make sure that that we're able to communicate that information as it comes out. I don't know exactly where everything will be posted yet. This is the first time we've done this, and so we're all learning as we go, and on the nuances of these types of things. We've done similar things with similar diseases, but the first time certainly with this magnitude of situations. So we appreciate everyone's understanding as we work through some of those details like that. But we want to make sure that we get the information to the plants and then to the public as that comes out.
Absolutely. And I guess the last question that I have is for Dr. Milton. You talked about how the first patient has been administered remdesivir. I mean, can you talk to me how quick does, I guess, this drug, change the situation for a patient? And I guess have they started to show improvements from the COVID-19 situation because of being administered this drug?
I haven't rounded this morning yet on that individual. I didn't hear anything overnight that was of concern. The drug is administered either in a 5-day course of treatment or a 10-day course of treatment. And from my understanding, the benefit that you would see is not something that you would see immediately. It's something that you would likely see over a few days' time. So, the process is that we administer the drug, and then we want to watch for any signs of toxicity by checking lab work and other parameters, make sure that it's tolerated well. And then I think what we'll try to do is treat for the initial 5 days and reevaluate where we are.
Absolutely. Well, that's all the questions I have. Thank you, guys. Have a good weekend. Stay safe.
Thank you, David. This time we'll go to Ariana Martinez of News Channel 10. Ariana, how are you?
Hey, good morning, everyone. This question is probably for either Dr. Milton or Casey. Have there been any reports of the inflammatory condition in children related to COVID-19?
Of course, I'm not a pediatrician, but I have not heard of any. I don't know about Casey if you've heard any.
Not that's been reported to public health, no.
And then just to clarify, are the Tyson testing results being included in county listings as they come in?
Yes, so each of those cases will be reported based on a county of residence, and so there may be employees who live in other communities, and so those numbers would be reported back to that person's county of residence. Yes, ma'am.
Thank you. And what makes the Canyon Senior Living Facility a hotspot?
So just like any other place, when there are groups of people together, that increases the risk. And so it's not necessarily anything special about one place. It's just the fact that people are together that increases the risk. And so it's most important to wear masks. It's important to stay 6 feet apart. All of those things that we've talked about over the last few months are so critical to slowing down and stopping the spread of transmission in any place. But I don't know that there's anything necessarily special about one particular place other than just people together.
Casey, is there a higher number of positives at that location than at other long-term care facilities?
Not necessarily.
And then with that definition, are there other areas besides meatpacking plants or this nursing facility that we would call a hotspot?
So there are, anytime that there's a place where people either live or work together in close quarters, that is an area of risk. I think that the term hotspot is a term that has kind of blossomed up out of different situations. It's not necessarily a technical term that we use, but there are other places where there are larger or that there are increased positives. And so so the answer to that question is yes, but I wouldn't, again, there's nothing necessarily special about a particular place. It's just where people live or work in groups makes that a higher risk situation.
Perfect. Thank you for the clarification. Do we know how many hospital beds are patients from the Clemens unit, or how many they're using?
Yes, I check on that every day, and those numbers are down. This morning, there were only 7 patients admitted that were correctional facility patients, and I believe only 4 of those were COVID related.
Oh. Perfect. And will today be the last day of the drive-through testing?
No, we'll continue that as long as we have supplies and we have the need. So we don't plan on closing that today.
Perfect. And that's all I have. Thank you, guys.
Thank you, Rihanna. At that time, that concludes our news conference for today. Once again, we do this 3 times a week, every Monday, Wednesday, and Friday at 11 a.m. This is David Henry, Communications Manager for the City of Amarillo. I want to thank our panel members for taking the time out to be here today and provide this information to the community. Once again, we'll see everybody next week. Thank you.
Thank you.